Hi, this is Aaron with Aaron Cook Insurance, and this is part three of Navigating Medicare 2025. In parts one and two, we talked about what Medicare was, what it wasn't, the things that it covered and didn't cover, as well as how to find additional coverage to fill those gaps that original Medicare left. In part three, we're going to look a bit more specifically at the costs associated with Medicare plans, as well as how to choose the right one for you. Like all health insurance, the costs with Medicare normally fall into one of the four following areas. The premium is going to be the fixed amount that you pay for coverage, usually monthly. The deductible is a set amount that you'll pay for covered services before your plan starts to pay. It's important to note that if you are on a Medicare Advantage Part C plan, the deductible that you have for that plan is separate from the Part D plan. Even though you signed up for both at the same time, you will have two separate deductibles, both of which need to be met in the respective areas. The copay and the coinsurance are your cost shares. You'll pay a determined amount every time you receive a covered service. Copays are determined by a dollar amount and coinsurance by a percentage. When looking at specific costs with a Medicare Advantage Part C plan, the premiums are usually very low. They range anywhere from 0 to 10, 20, 30, even $50 sometimes. Your deductibles are going to be anywhere from a couple hundred up to about $3,000. It does vary, and there are ranges outside of that as well, but that's what I find to be typical. This is the amount, again, that you're going to pay up front before your plan pays anything. However, with a Part C plan, there are many covered services that you can receive that don't require the deductible. The plan that you're looking at will explain all of that to you in detail. The copay and coinsurance, you will pay up to a specific amount called the annual out-of-pocket maximum. All Medicare Advantage Part C plans have an out-of-pocket maximum. In 2025, that amount is around $8,000. That means that, including your deductible, you will not pay more than $8,000 in any given year. Now, just like the deductible and the premium, this out of pocket does vary plan to plan. So make sure that you read your plan details very carefully. The Medicare supplemental insurance or a Medigap plan, your monthly premiums are typically going to be much higher than they would with a Medicare Part C plan. However, the deductibles and copays are going to be much less. When I'm talking to my clients, I like to kind of ask them the question whether they want to receive a monthly bill in the beginning of the month and have no medical expenses, or if they'd rather pay nothing up front and then have to pay when they seek the care. This is almost the difference between a Medigap plan and a Part C. With the Medigap, you're going to pay up front. You're going to have one bill coming in from your insurance company, and then your insurance plan covers almost everything. With the Part C plan, you're not going to pay anything up front, and you'll only pay when you seek care. Now, this can be great if you're healthy. However, if you need to see a doctor a lot, you're very likely going to hit that $8,000 out of pocket. With the Part D prescription drug plan, most plans may have a monthly premium. It's going to be anywhere from $10 to $20. You will have a deductible. And again, this deductible is separate from either your Medigap or your Part C plan. You may have a copay and coinsurance, and this typically varies based on the tier of the drug you're purchasing, as well as which coverage area you're in. So how do you choose a plan that's best for you? If there's anything that you take away from this entire video series, I want it to be this. Make sure you are shopping for insurance and not for perks. Many health insurance companies will distract you with goods and services, and that's all they are doing is giving you distractions. Your health is your first priority, and you need to put it first. Everything else is secondary. In our day and age, convenience is king. Meals delivered to your house, rides to and from doctors, those are all great, okay? But we need to make sure we are receiving the medical care that we need first. Receiving an over-the-counter card for $25 usable for Kleenex and dog food will do you no good when you're in the emergency room. So let's review the combinations that we can have. If you stick with original Medicare, that's going to be your Part A and Part B. You can add on to that a Part D or a Medigap plan or the combination of the two. By having A, B, D, and a Medigap plan, almost all of your care is going to be covered. There are going to be a couple of holes, specifically long-term care. With a Medicare Advantage plan, you can either have just the Part C by itself, and this is really recommended for people that have Part D prescription drug coverage elsewhere, or you can have one bundled with Part D for you. When looking at what is going to be best for you, the first step is going to be to enroll in original Medicare. No matter which route you go, you have to make sure that's done first. Deciding if you need additional coverage and which way you want to go should be the next step. This is a very private choice. It is one that I don't recommend the same thing for everybody. A lot of times the Medigap plan makes the most sense. I would say for most of my clients, I recommend they have a Medigap as long as they can afford it. The cost on these does go up every year. However, the coverage is very robust. You will not have almost any out-of-pocket cost. The Part C plan offers a lot of benefits, and for some people, this is a great value. Having the dental coverage, the vision and hearing coverage, along with some additional benefits not provided by original Medicare, is a value-added service. And I understand the draw to that. However, reflecting back on a couple of slides ago, make sure you are shopping for health insurance, not for perks. Let's look at the Medigap and the Medicare Advantage together a bit more closely. With our coverage options under Medigap, the Medigap plan will pay most of the cost not paid by original Medicare. Now, remember, this is going to be that 20% uncapped amount for our Part B doctor's insurance, as well as the per benefit period cost associated with going into the hospital and staying there overnight. It does not help with drug cost. The nationwide coverage is great because you don't have to worry about whether or not a doctor's in network. Additionally, some plans do offer some value-added services. When looking at the coverage options for Medicare Advantage, remember that it provides all the benefits of original Medicare. That's going to be everything that A and B provides, plus they provide a little bit extra. Most plans include a prescription drug coverage, which is great for people that only want one insurance card to have to juggle. You do, however, have to worry about your provider network. Additionally, there are some added benefits such as dental and vision that are added on by most plans. When comparing the cost with a Medigap plan, you're looking at a larger monthly premium. You will also have a drug plan premium. And the out-of-pocket costs depend on the plan chosen. However, they are typically much lower than with the Medicare Advantage. Again, remember, with the Medigap, you're paying your cost up front. With the Medicare Advantage, you're looking at a very low, if not zero, monthly plan premium. There's often no additional premium for drug coverage. However, you will have a co-insurance and co-pay for almost all covered services. And you will have an annual out-of-pocket maximum. Again, when we're looking at this, you need to consider, am I okay gambling with my health? If I'm healthy, I won't pay anything, and that's great. But if you need to see a doctor or a specialist, you might be hitting that, having to feed into that deductible and potentially hitting that annual out-of-pocket maximum. Convenience is a matter of personal choice. When you have a Medigap, it's multiple plans. Now, for some people, this may not be bad. Some people may want to be able to shop around and find the perfect drug plan to match their Medigap. Perhaps they really want this dental plan and that vision plan and don't want to have to stick with what the Advantage plan is. In the same light, some people like an all-in plan. They don't want the hassle of having 4 or 5 different insurance cards or having to worry about 4 or 5 different policies. That's going to be a matter up to you. Coming up on part 4 will be how to enroll. We'll bring up that one shortly.